what we call step therapy on metastatic cancer. Metastatic cancer is cancer that's already progressed through the body from its original area into tissues and other areas of the body. And many times it would be required that what step therapy is, that the insurer would require that step number one be a certain process. And if it didn't work, then you try treatment number two. And then you finally get to the treatment that's proved most effective. Well, what we did was we said that it cannot be required. The House passed that bill, and we did what we thought was a responsible thing. I talked with Commissioner Cheney. He said he did not think it would have any negative effects on the state health plan. It would not be a large cost to insurance plans. 4 years later, we had a study this summer. The state health plan said it was a negligible amount. So all we're doing here is removing the repealer on that, on Senate Bill 2367. Is there a motion on that?
Motion be title sufficient to pass.
Motion is title sufficient to pass. All in favor, please say aye. Okay, I want to skip down to the sixth item, Senate Bill 2694, because it's a bit similar to this metastatic cancer bill we had. It deals with biomarker testing. The committee that we put together this summer to study health issues had 20 different presentations. And at the last meeting of the committee, we decided what issues needed legislation. And this was one issue that was overwhelming interest to bring out legislation on from the committee. And I want to tell you who was on the committee to let you know what broad range of experts we had. It consisted of the chairs of the Public Health and Insurance Committees in both the House and the Senate, the Commissioner of Insurance, the State Health Officer, 3 medical doctors, and a representative from the State Health Insurance Plan. And as I said, this was one of the 2 items that came out of over 20 presentations. The House has already passed this bill. Members of the committee, you have a little summary of what they passed. They referred to their bill as Jill's Law. You may have heard the publicity on that. We were hoping to take up the House bill, but it was not referred to us quick enough. So you have before you the Senate bill. This is a mirror bill. The gist of this is that, like that metastatic cancer bill we just passed, this bill takes biological markers or biomarkers contained in a patient's tissue or blood and targets a patient's treatment. That allows, in the instance of cancer, some patients to be able to avoid broad treatments like chemo or radiation and receive a targeted treatment proven more effective. There's currently also research underway to benefit patients with heart disease, Alzheimer's, and infectious diseases. The first 5 pages of the bill contain the gist of the legislation, and the following pages online, just one change on line 1006 and 1500 conform to Medicaid rules and also the prior authorization laws. Any questions on this legislation? Is there a motion?
Motion to be title sufficient to pass.
Motion is title sufficient to pass. Senate Bill 2694. All in favor, please say aye. Any opposed? Okay, that bill will be reported. Now we go to the second item on our calendar, Senate Bill 2384, and I recognize Senator Suber.
Thank you, Mr. Chairman. This bill basically just sets a standard for the National Association of Insurance Commissioners. I think Mississippi's complying with all the standards now, but this just basically sets a limit where no one can provide services that are not up to that standard. So I don't think there's a whole lot of detail in it. But if you look at lines 20 through 24, is a pertinent language. I'll be happy to answer any questions.
Are there any questions?
If there's no questions, I'd move title sufficient to pass.
Motion is title sufficient to pass. Senate Bill 2384. All in favor, say aye. Any opposed? That bill will be reported. Senate Bill 2390, Senator Kirby.
There we go. Thank you, Mr. Chairman. I have a proposed committee substitute I'd like to explain.
Okay.
Before
you're recognized to address the committee substitute.
Okay. Ladies and gentlemen, let me tell you what this is. This bill requires any contractor or person who installs or modifies or alters a private residence elevator to be properly licensed through the Department of Insurance Elevator Safety Division. Elevator be properly inspected and deficiencies corrected before the elevator be placed into service. The owner or elevator contractor would be responsible for registering the elevator with the Department of Insurance A permit would need to be applied for and approved by the Department of Insurance before work could be started. And the Elevator Safety Division would issue a certificate of insurance. Now, that's what the bill does. If you'll notice on the committee sub, I changed one thing here on line, let's see, what is it, 35, 36, 37? I added there, except that elevators shall be exempt from requirements of an annual inspection. In other words, they'll only be inspected the first time. The purpose of this bill is to save lives, if you want to know the truth about it. We passed this bill back a few years ago. Senator Carmichael actually passed the bill, and then for some reason it got tied up in the House and didn't pass over there. So I would ask that we consider this bill and pass it this year. Again, this is all it is on residents only, and it's for just elevator inspection before it's in service. And I don't know how to say this, other than it may keep some Jake legs out of the business of putting up what they call elevators that aren't safe. There have been occasions that people have been injured and even where children have died because of improper installation of elevators. So if no questions, Mr. Chairman, I move that we adopt the committee sub.
Are there any questions on the committee substitute? All right, motion is we adopt the committee substitute, Senate Bill 2390.
Yes. Yeah, motion is that we adopt the committee substitute. Then I'll ask.
Title sufficient do pass.
Title-
Committee substitute.
Yes.
Okay, motion is title sufficient do pass, committee substitute, Senate Bill 2390. All in favor, please say aye.
Aye.
Any opposed? That bill will be reported. Thank you, Senator Kirby.
Thank you, sir.
Senate Bill 2409, Senator Delano.
Thank you, Mr. Chairman. Ladies and gentlemen, committee, this is the mitigation program for retrofitting of homes that we've seen numerous times over the past couple of years. And you know that I have been very passionate about this issue. Mr. Chairman, I want to say thank you publicly to the Commissioner of Insurance and especially his staff for the work that they've done on this issue over the last couple of years. Last year, I had some concerns about how the program was run or how it was being proposed to be run. I'm very happy to be in front of the committee today to tell you that we are in a really good place in our work with the Department of Insurance to get this to a point where I think we're very close to getting a significant program accomplished for not just South Mississippi, but for the entire state. Ladies and gentlemen of the committee, there's not a proposed committee sub at this point. There may be amendment that we will make on the floor, but we are working very diligently with the House as well as industry leaders to make sure that Mississippi's program is going to be a very successful program. And at this point in time, Mr. Chairman, I would like to just go ahead and ask the committee to go ahead and pass this out to the calendar, give us an opportunity to work on it again and again. And then, like I said earlier, we may have a committee or amendment that'll happen on the floor, but right now the motion will be title sufficient to pass if there are no questions.
Dr. Dick, could you just quickly describe the funding? That would be important. I think it's very similar to exactly what we passed last year, but there's one change on allowing third-party administrator. Isn't that correct?
Yes, but that's not necessarily part of the funding component of it. That's actually part
Two
of the,
changes.
yeah, they're actually part of the programmatic side. The commissioner and the Department of Insurance has asked for a third-party administrator to help facilitate the effectiveness and the efficiency of the program. It can be limited to no more than 5%, or the amount paid to that third party can be limited to no more than 5% of the total funds available for the mitigation program. That is in line and in keeping with what we've seen in other states and what has been effective in other states. And I'm very pleased that they've added that language in it and that we've become comfortable with it. With respect to the funding model that's proposed in this bill, comes from the Commissioner of Insurance. This is very similar to what states of Alabama specifically have done. I believe Louisiana has done it the same way as well. And that is to increase a fee from $25 to $50 for each company that offers I think the word is a subscriber, an appointment to a producer. So this is something that we paid for by the insurance companies, and it would not affect the policyholders directly. And I think that it is a very good policy for us to support. And again, I thank the commissioner for bringing this forward.
Okay, we have a motion, title sufficient to pass Senate Bill 2409. Any additional questions? All in favor, please say aye. Any opposed? That bill will be reported. Senate Bill 2479, Creating Transparency and Accountability in Dental Services Act. This legislation is something many members of our committee have participated in NCOIL, National Conference of Insurance Legislators meetings. And it's an issue that's come up there, and obviously an issue that's been important in Mississippi. The original version of this legislation involved mandates on certain percentages of dental insurance premiums going towards actual services. The national organization, along with NAIC, National Association of Insurance Commissioners, took a step back from that and said, you know, we're not at this point interested in mandating percentages of premiums go towards services. So all we have done in this legislation is create some transparency to where the insurance commissioner now will receive information on the amount of money spent on dental services as a percentage of the total premium. This legislation will go into effect July 1st of 2026, and the first reporting will be December 1st of 27. And the reporting will be December 1st of each calendar year thereafter. So it will actually be several years before we have enough data to really even see what's going on in the market. Are there any questions on this? We have a motion. Senator Barr moves title sufficient to pass. All in favor, please say aye. Any opposed? That bill will be reported. Senate Bill 2699. This is deals with our state health plan. On line 180, extends the repealer 4 years. We have a repealer in this legislation just to have our state school employees' health insurance and life insurance plan before us. This legislation will allow the board to continue to operate, to continue to take premiums and operate and provide insurance for approximately 190,000 Mississippians. That's your school teachers, your state employees. You see on line 11, your local school districts, your colleges, universities, community junior colleges, and public libraries. That's simply all we're doing is reenacting statute. Any additional questions on that? Is there a motion, please?
Motion be title sufficient to pass.
Motion is title sufficient to pass. All in favor, say aye. Any opposed? That bill will be reported. Senate Bill 2700, Senator McClendon.
Thank you, Mr. Chairman. Committee, Senate Bill 2700 is the LoSAP bill, which we passed last session, and we funded it for $3 million. What this does, it extends the repealer for 4 years. It carries it to 2030. What the LoSAP program does is it was designed to help recruit and retain volunteer firemen all over the state. There was a board set up, which that board is in place now. What this board has been doing is gathering stats of how many years that firemen have had in place. And they're almost at the end of that process. Total firefighters in this program are 6,615 today of volunteer firemen. So this is a good thing. What we'll probably need to do is in the future, add more money to it. Now you say $3 million, but then you start dividing number of years in service. The average age of our volunteer firemen, 46 and a half years old. Average years of service for volunteer firemen, 14.7 years. As of right now, there's a limit on what they can get. It's $500 a year maximum for a person that's volunteer fireman that goes all over the state helping our loved ones and businesses. So with that, I would ask that the committee approves this and extend this repealer on this bill.
Yield for a question from Senator McMahon, please.
Yes, sir.
Thank you, Mr. Chairman. Thank you, Senator McClendon. I fully support this. I have a question. So we established this, was it 3 years ago that we established it? 2? Okay. Has a single service award been issued to a single volunteer fireman anywhere in the state?
No, sir, not yet, because the board was just in place this past year, 25,
Right.
because they had to go through the appointments from each sector that they had to go through. And then there was a message that were sent out to all fire departments to gather information of how many years, and the deadline was this past December 31st.
Yep. I appreciate that. I've got a constituent that has 57 years of service on a volunteer fire department, and I'm just completely confused as to why not one grant or award has been issued anywhere in the state. So thank you.
Yes, sir, that they had, they're gathering information, and the last day to submit any information was December 31st, 2025.
Senator Delano, you recognized?
It's probably more of an appropriations question, but I'll go ahead and ask it now. But of the $3 million that we appropriated in the previous years, how much of that has been spent to date?
0.
Okay, and then for the extended repealer that you're asking for 4 years, what is going to be the fiscal note on, or what is the request for additional appropriations funding?
At this point, 0. No more additional funding at this time.
Okay, then let me back up kind of to McMahon's question.
Not to say that it isn't needed. It's just not asked for at this time.
So remind me again, how much is the award amount that is supposed to go to the volunteer program?
3 million.
For a fireman?
3 million was put in the program. It's a maximum of $500 per service year that they can collect on. And at this point, with the 3 million and with the firefighters of 6,615 and total years of service is 97,541. Available funding equates to approximately $30.76 per year to each of those firemen. $30.76 per hour, which is not quite $500 a year.
Per year? Okay. All right, well, we'll continue that in appropriations. Thank you, Mr. Chairman.
Okay, this is obviously a very valuable program. Many areas of Mississippi, the volunteer firefighters are the only source of service to the rural areas. So, Senator, you have a motion?
Motion to approve. And extend the repealer, excuse me.
Motion is. on
Title sufficient.
Sufficient due
House
pass.
submission do pass.
2,700. All in favor, say aye. Any opposed? Okay, that bill will be reported. All right, Senate Bill 2,700. Excuse me, 2,701. This, because of AI and also cybersecurity fraud that's really increased over the last few years, this legislation under the Commissioner's Office will set up a fraud detection trust fund at the Mississippi Insurance Department. There's no legislative appropriation. The Insurance Commissioner can receive federal or private grants. The Insurance Commissioner will set an annual contribution to be received from insurance companies to fund the account. Are there any questions on this? Senator Johnson.
Thank you, Mr. Chairman. I can see in sections 1 and 2, it's new language creating the fund. In section 3, it's existing language about collecting from insurance companies based on their gross premiums. It sounds like a pro rata collection that's already in existing language, and we add the fraud detection trust to existing insurance department fund. So do we already collect money from them? If so, where does that go? And, you know, I get a lot of feedback from constituents about the price of property and casualty insurance premiums presently. Will this cause those rates to go up?
Okay. It's my understanding that fund has been pretty dormant. Commissioner, would you please address that? The fund has been dormant since 2016, is that correct? But we're changing the name of it to allow it for fraud in investments. We're changing the name of it.
Section, it's very complicated and we've got a lot of data.
So there's a current balance of $750,000. But that's not the current balance. I get it pro rata based on their insurance premiums at a gross.
Scheme of things, you're only talking about $250,000.
And do these insurance companies not have their own fraud detection systems?
They do, but here's the problem. We've got the smallest detection system in the United States outside of one in Montana. Problem is that we've never had the funding. We've got 4 people in our fraud division. To give you an example, when you turn an ACA account and the agent is in Florida, but by ferocity, they also are licensed in Mississippi. They will turn an account 10 times a day before it ever gets to ACA. They make a commission off of it. We're talking about $650 million last year just in the southern states letting out the fraud, committed fraud. We've got 40 licenses we have to flag today. We can't do anything about them except flag them so they can't get a new appointment. We can't call them in for a hearing because they don't show up. What they do, they lose their license, come right back and get it again. The fraud constitutes 33% of your premium cost on homeowners. It constitutes over 25% on healthcare. And we just don't have the money and can't get it from the appropriation committee. The only place we do it is raise the fee.
Right, but the insurance companies that are where the fraud is committed against, they don't have detection systems or a way to push back on that?
Extremely complicated kind of an arson investigation. And you've got, well, a good example would be the Jewish synagogue that was volunteer. The guy had not confessed to his father, but have never been discovered because we weren't called in until the last minute. And that's fraud. A lot of that is fraud. And problem is the companies are limited as to what they can do. So what they quit doing is quit fighting. And that's true, especially for roofing. Where you know the issue with roofing, you've had a problem, you've got a lot of complaints. 15-year account on roofing because of the fraud that's involved. It's complicated. There's a lot of parts to the puzzle, but if you do not have funding for fraud, you can't go after the people that commit fraud. You got to work with the AG because we only have civil fraud. We do not have criminal fraud.
So you mentioned currently you can just flag, you said you can just flag people that you believe are committing fraud and not renew their license. How will this fund help change that?
You can't get another appointment. That puts the people on notice in Florida to come in and look at it. You understand where we're coming from? Well, what we have to do, what we really need is more investigators. And complicated. If you don't want to do it, don't do it. All we're asking for is don't get the money.
Gotta get the money. In the scheme of things, $250,000 is a well-spent amount of money if you save consumers over $200 million of fraud. So let me tell you, every time you have a fraud case, lose a house, it's over $200,000.
So the fund would help you with investigators? And it would pay their salaries, or it would pay for equipment, or? Okay, thank you. Any other question?
So I'm pretty open about that. So we gave back $8.5 for appropriation.
Well, because of AI fraud, yeah.
We spent $12.5 million on our agency, bringing in $400 million. Was the fourth largest user of income on the state.
The person with insurance.
Thank you.
Okay, Senator Delano.
Wow.
All right.
All right, I think this will be to you, Mr. Chairman. And we may need to get some clarification from the department. But I've had a lot of constituents who have received phish emails from what appears to be insurance companies for payments that are due to a hospital or for healthcare purposes. And there seems to be really nobody that really goes out and investigates that. But we know through cybersecurity crimes that hospitals and K through 12 schools are the two most targeted entities for cyber crimes. Is that, I mean, are some of these cases where you have these phish emails that are being sent out all over the place? I mean, are you trying to come up with some type of a detection to look upstream to try to find where this is or where these emails are coming from and trying to get the proper authorities involved or engaged, because most of this stuff is international type crime?
Complicated. A lot of what we do on cybersecurity, making certain that the data is long, secure, and that we're not just by taking on.
Thank you, Mr. Chairman.
Senator Kirby.
Thank you, Mr. Chairman. If maybe I'm off base, but it looks like all we're doing is changing the name and raise it. We already have the law. We're raising it $250,000 from 750 to $1 million. And in addition to that, we're just changing the name to make it more obvious where the money's going. Am I correct?
That's correct. Yes, sir.
Thank you.
In the world we live in, it's something as simple as someone impersonating your agent could send you an email and saying that, you know, they have a new mailing address. Please send your premium for your home to this new address. And oh, by the way, transition right now, make it payable to John Smith, insurance agent. And, you know, they may send 100 of those and 95 people may realize that that's fraud. But, you know, if they get 5 of them, that could be some significant money. There's just so many tricks out there right now in the world we live in through AI and through the internet. So,
Mr. Chairman, I have a motion at the proper time.
okay, you're recognized.
Motion to be title sufficient to pass.
All right, title sufficient to pass Senate Bill 2701. All in favor, say aye. Any opposed? That bill will be reported. Senate Bill 2704, Senator Blackman is recognized.
Thank you, Mr. Chairman. What Senate Bill 2704 does is it expands healthcare coverage options for Mississippi small businesses, professionals, and self-employed individuals by allowing members of legitimate professional and trade associations to access self-funded group health plans that are already regulated by another state or the federal government. And to qualify, a plan must be established by a legitimate professional or trade association that has existed in good faith for at least 3 years and was not formed solely to obtain insurance. It only covers members who are in the same profession or trade, and it complies with ERISA and the laws of the domiciliary jurisdiction. It maintains actuarially sound rates, reserves, and excess insurance, it operates as a nonprofit entity and it not be marketed or sold to the general public. And the Mississippi Commissioner of Insurance must review the plan and determine that all requirements are met before the plan can operate in the state. And the plan must recertify compliance every year. And to give an example, we have issues in rural communities where small law firms can't bring on a new attorney to help because they can't cover the health benefits and associated costs. And this would give them an option to find a way to bring additional attorneys or additional professionals in other trades to those areas. I'll yield for any questions.
Seeing no questions, is there a motion, Senator Blackman?
Title sufficient, do pass.
Title sufficient, do pass to the motion for Senate Bill 2704. All in favor, say aye. Any opposed? That bill will be reported. Okay, Senate Bill 2752, former committee member, Senator Blackwell will present this to us.
Thank you, Mr. Chairman. Senate Bill 2752 is a Mississippi Patient Protection Act. It basically strengthens patient rights by limiting discriminatory practices by health insurers and reinforcing patient choice for providers. It clarifies and strengthens enforcement of our current existing willing provider protections. Basically, what the bill does is ensures fair access to healthcare providers by prohibiting insurers from discriminating against qualified providers within a plan's geographic coverage area who are willing to meet the plan's terms. It protects patients' choice by preventing financial incentives or penalties that steer patients away from participating providers. It provides remedies for violations, including injunctive relief. It authorizes rulemaking by the Commissioner of Insurance to implement the act, and it aligns statutory language by amending Section 8341-409 of the Mississippi Code. That's a brief explanation of the bill. And in transparency, I did receive some concerns by people who deal with some vision benefits. And to that end, I have an amendment at the proper time.
Questions on, well, let's address the amendment first, please.
I'd like the amendment to read, the term vision benefit manager shall not be construed to include a pharmacy benefit manager, nor any entity engaged in the administration or management of prescription drug benefits or pharmacy services, including entities regulated under pharmacy benefit manager statutes. And I have this for council. That's an explanation of the
Okay, and what would
amendment.
be the gist of that amendment? What would it accomplish?
I'm sorry.
What would the amendment accomplish? It was quite lengthy.
Well, there was concern by these folks that they might be included in pharmacy benefit management law as it comes about, and that's not the intent of the bill. So this just further clarifies that.
Any questions on the amendment? Director McClendon.
Does this change the scope of practice of any individual or entity? Thank you.
Any other questions on the amendment? Okay, all in favor, say aye. Any opposed? Okay, now back on the bill. Questions on the bill, please. This is a committee substitute now that we'll be bringing forward.
Motion at the proper time.
Seeing none, Senator Delano.
Motion be title sufficient, do pass committee sub.
Motion is title sufficient, do pass, committee sub, Senate Bill 2752. All in favor, say aye. Any opposed?
Motion, Mr. Chairman.
Now motion from Senator Delano.
Rise and report.
Motion is to rise and report. All in favor, say aye. Any opposed? All right, you want to get with Blackwell before he gets away and get that language?
I'll catch up with you.
That out.